One thing I learned in this housemanship is the grace to control my mouth. Ask question, jukwa question, ask question. You're planning to write exams to Japa, hands on, so you will learn more, so you have more, what they call it, clinical experience. I like telling them my mind. So if they ask me, I'll just say no. So I'm not interested. Ha.
I found peace in your violence. Can't tell me there's no point in.
Hi guys, hi beautiful people, welcome back to my YouTube channel. If you're new here, my name is Kamsivie and I'm a content creator based in Abuja. In today's video, we're going to be talking about housemanship in Nigeria. So in this video, I'll be covering everything you need to know about housemanship in Nigeria. This 1 year program, this housemanship, I'll be telling you the tips and tricks from my experience of how to survive in this housemanship. Everything you need to know, I'll be giving you the tips and tricks in this video. So if that's what you're looking for, please don't forget to give me a thumbs up, please don't forget to subscribe, and let's get right into the video. Let's talk about housemanship. Housemanship is a 1 year clinical training which is 52 weeks, in which new medical doctors or dentists are expected to get a 1 year clinical experience under supervision. So this training is basically for students or graduates from medicine or dentistry. So you're expected to get 1 year clinical experience. In this clinical experience, you're expected to collect, diagnose, examine live patients. So basically it's everything you've learned in College of Medicine. So this one you're now practicing it under supervision. So basically this is not even about reading books now. So all the things you've read in your school, in your 7 years, 8 years of medical school, this is the year you now have to like treat these patients now. It's not about cramming learning. This is now when you treat patients. This is now when you touch patients. This is now when you put in those things you've learned into practice, basically. So that's what 1 year, this 1 year is going to be about. For this 1 year, you're expected to rotate through 4 units. So for medicine, that's for medical doctors, you're expected to go through internal medicine, surgery, O&G, and pediatrics. While for dentistry, you're expected to go through preventive dentistry, oral and maxillofacial surgery, restorative dentistry, and child dental health. So that's for dentistry. So for each unit, you're expected to spend 13 weeks. That is 12 weeks of working, that's 12 weeks of coming to work, and 1 week leave. So you're entitled to, every unit you're entitled to 1 week leave, while 12 weeks of working. Like I said, 13 weeks, I didn't say 3 months. So you have to be a very smart person. You have to be counting it weekly. First week, Monday to Sunday is 1 week. Monday to Sunday, 2 weeks, not monthly. I'm meant to spend 3 months because some months are longer. Do you understand? So you have to count them weekly, not monthly, so that you don't have extra days for you. So as an house officer, you are the lowest in cadre. So you're expected to, so you're the one, you're in short, you're the first in line. You're the first in the call rosters, you're the first in everything. So everything falls back to you as an house officer. But the only difference now is you're still under supervision. So the things you're expected to do as an house officer is clerk patients, examine patients, document patients, fill in investigation forms, pass NG2, pass catheters, give IV medication. This one depending on your center. Like my center, we don't give IV medications. The nurses are in charge of those ones. So depending on what center you find yourself, you might be expected to give IV medication. Sometimes we give, but most times we don't. So surgery, some surgeries you're expected to assist them. You're also expected to set IV lines. That's IV lines. You're expected to get blood for patients for surgery. Then for dentistry, for preventive dentistry, you're expected to do S&P. You're expected to do root planing, depending on your center. Like my center, I did not do S&P because the therapists are expected to do that. So depending on your centers. Then for child dental health, you're expected to change wires, change elastics, fix some centers, you fix brackets, but my center, well, next we didn't do that in my center. So in some centers you fix broken brackets. Then popotomy, popectomy, some centers will allow you, no, you're meant to popectomy, popotomy, you should do that one. Then for restorative, you're meant to do RCTs, you're meant to do composite restoration, GIC. Then for maxillofacial, everything I just said, for giving IV medication, NG tube, you're meant to do that in surgery, maxillofacial surgery. Also, you're meant to assist in IMF, or you're even meant to do IMF. You're meant to assist in third molar surgeries and suture. You're meant to suture patients. So let's talk about how do you get your housemanship. So recently, MDCN, that's Medical and Dental Council of Nigeria, are currently in charge of that. However, not every hospital are under MDCN. So I think most state hospitals in Nigeria are different. They're on their own. So I think you have to apply to those hospitals, and then you write exams and they will take you. Why MDCN? You have to have a portal. When you finish as a student, you're meant to create a portal with MDCN. So from that portal, there will be a list of hospitals that are under them, basically, that you can click on and go for your housemanship. However, not all hospitals are going to be in that portal. Not every hospital. I know Lagos and Abuja doesn't come in that portal. You will never see it in the portal, so you have to work it. Yeah, you have to work it. However, there are hospitals in Abuja that are not under MDCN, like general hospitals are not under MDCN. So basically in Abuja, there are just two hospitals under MDCN, which is National Hospital and the teaching University of Abuja Teaching Hospital, Gowalada. These are the two hospitals that are under MDCN, but you will never see it in that portal. They will never come out in the portal, so you have to work to get these hospitals. So for the other hospitals in Abuja that are not under MDCN, which is Wuse General Hospital, Maitama General Hospital, Asokoro General Hospital, and so on and so forth. These hospitals are under FHMB, so they're under FCT Hospital Management Board. So these hospitals, you have to apply. So they don't have a portal, they are not under MDCN. So you have to go to their office in area 11, somewhere in area something, Garikisha. You shall go there and you send in your documents and you apply for this hospital. So that's how to get those hospitals. But for National Hospital and University of Abuja Teaching Hospitals, they are under MDCN. So in as much as they don't come out, you have to find your way to get those hospitals. Some state hospitals, they don't come out in the portal too. So, but teaching hospitals most times are always in the portal. So depending on where you want to go to, so you just go into the portal and you click where you want to go to. So now all this is said, so let's get right into the tips of how to navigate your house job or your housemanship. So the first tip is, housemanship is stressful. See, let nobody deceive you. I'll be very honest with you and I'll be very blank with you. Housemanship is stressful. No matter the center you find yourself, housemanship is stressful. And funny enough, nothing prepares you for this kind of stress. If you think as a student medical school was stressful, housemanship is worst. So just make up your mind that you're gonna be stressed. There's no living a soft life, though there are some units that might not be stressful as the other units, but even though housemanship is going to stress you, so just make up your mind for that one. So now the only thing you have to do for yourself now is to find a center that is less stressful. The more the doctors, that's the more consultants, more senior regis, the more the house officers in a center, the lesser the work, because you might be, so there'll be more house officers, that's HO. Let me just be saying HO because my mouth is paining me. So the more the HO in a unit, the lesser the work. So that's why I said, and the more doctors, the lesser the work. So you have to find a center that there are more doctors and there are, if possible, less patient load, more doctors. So that's one here. Even though it will be stressful, but it will not be as someone that is in a center with less doctors, more patient load, less house officers. You will see hell. And forget all these It's good to go to a center where you can do hands-on, so you learn more, so you have more, what they call it, clinical experience. You die before your time, to be honest, especially if you're planning to write exams like maybe PLAB, USMLE, you're planning to write exams to JAPA. Please look for a center that will not stress you. I beg you in the name of God, because you need to read. So in as much as you are still looking for clinical experience, so you still need to read your book. And clinical experience no dey finish. If you still want to go for residency, you get clinical experience. Me, I don't know how to keep myself o. You will get this clinical, you even have, if you're going to serve, if you're going for service too, you still get more clinical experience. So all these things, don't allow anybody to guilt trip you into, oh, I'm looking for a center that will have more clinical experience. Please check the center. Are they less patient load? Are they more doctors? Do they have more house officers? Do they have more doctors on ground? So that, especially if you want to jackpot, so that you can read your book, so that you cannot die before your time. Another thing you should do, because you have to ask, so look for people that have been to that center. If you have like senior colleagues in school that went to the center you're looking for, or just ask around, ask people. Okay, you have list of hospitals you want to do house job. Look for people that have gone to those hospitals, people that did their housemanship in those hospitals. Ask question, jukwa question, ask question. Is this stressful? What's the patient load like? How is the doctors like? How is the consultants like? Ask question. So the next tip is study. So please, don't be like me, oh. Don't be like me, but please, before entering any unit, any unit you want to enter, because I said there are 4 units, so please study. Know the basic things, like read those things, know them, so you don't look like a dullard. So at least you not come and be disgracing your school. Do you know this? Because me, I said I was not going to read, that my head is paining me. After the exam, I saw like I was like, me, I was not going to read. The first day I came into, which unit was that? They asked me one question, I was just moping. I know the answer was just dangling in my head like this. So it just made me look like, who is this unserious person? I don't think that's the kind of first impression you want to be giving them, especially your consultant, your senior already. So just read. I know somehow you say, after the exam I wrote, abeg, my head is paining me, I don't want to read anything. But just try and read the basic things around each unit you're going to, so that when they ask you questions, you not look like a mumu. Some consultants, some senior colleagues just want to intimidate you, especially when you're coming from a certain kind of school, or you're foreign trained. That's another one. If you're foreign trained, most times they'll just be like, this one did not teach them well from where they are coming from. So, and you have to prove them wrong. So read before, study before coming into a unit. I don't know what's with them and the university, so they just want to show you that your university don't know anything. So when they now ask you questions now and you're not answering, or you're doing like, you're dumbfounded, it just looks as if it's either they don't teach people well in your school, or you're just a olodo. So so try and study before going to any unit. When you study before going to any unit, it just stops any form of insult, any form of intimidation. Some people want to show you they are the boss. Just read. So if they ask you, just be vomiting things, like, this one no, so there's some stuffs in your head, you just, they're percussing you, you're answering. So you know that, this one is no go area. You get, as for that first impression, at least let it be good. So the next one is toxic senior colleagues. Yes, they are wicked and toxic consultants. So you have to be aware of this one. So basically, how you tend to find out this thing is, when you get, okay, before you, let's say the first unit, now you come into a place, you don't know anybody, let's just assume, but subsequently in your next unit, you should look for people, or HOs, as house officers, that finish from that unit or are in that unit. Ask questions. What are the consultants like? What are the senior regis like? What are the regis like? So before you get into that unit, so it just prepares your mind for what you should be expecting. Some consultants are toxic, so you have to know the consultant that insults people. Their senior colleagues, let me not even say consultant, any of them, senior colleagues. There are some senior colleagues that insult people. There are some consultants that love extension. small thing extension, small thing extension. So you have to ask question, ask people, what are these consultants like? How do they behave? What can I do that will make them, what can I do that they will give me extension? What does this consultant like? What does this consultant doesn't like? You know, just ask questions. So then for ladies, they are so for ladies, oh, just take note, there are some consultants that are humanizers. You shall know when someone is hitting on you or when someone is striking you. So don't come and do I like telling them my mind. So if they ask me, I'll just say no. So I'm not interested. Ha. You be coming down, oh, you be coming down, make them not give you extension, or make they don't start picking on you unnecessarily. So you just be following them. You know how they used to do it now. Be following them with sense, you know. Laughing like mumu, but uche like your mind is there. You get. If you know he's checking you, oh, can I see you today? Sir, just that I'll be going home. I'll be this. I'll just try make excuse, but don't come and be tell them blunt no to their face. You get, just be following, like just be taking him round and round and round and round and round till he leaves you alone. Do you understand? Don't come and tell them no to their face, especially some senior regis, some regis, consultants too. They chase women. Yes. So just try as much as you can to just be following them round and round till you get out from that unit, till they sign your form. You carry your bag and your slipper, you don't even need to dust it so it doesn't make noise. You put it on your head and you run. So but once you're still in that unit, don't come and be doing I'm too big for, you know, I give them how it is. Once they ask me out, I say no. They will keep you in that unit and there's nothing you can do. Literally nothing you can do. So just follow them with sense, apply wisdom when they are chasing you. So the next tip is always learn to document your patients, especially when it's clinic days and there are so many patients. You may just be tired. You don't, please just document your patients. You collect them, document. Examination, document. Diagnosis, document. Medication given to the patient, document. Everything you did in that individual, document it. Oh, document it. If a patient doesn't want treatment, give them to sign llama. That's, you know what llama is now, live against medical advice. Let them sign llama. Document everything any patient that walks into that clinic and you see that patient, please document your patient. Any treatment, any investigation, document. When the results are out from the investigation, document. So the next tip is always ask for help. So if you're not sure of anything, ask for help. Anybody can help you. Your senior reg can help you, your reg can help you, even the matron, the nurses in the ward can help you. If you're not sure about any procedure, ask for help, call for help. Don't go and do more than yourself, don't go and do pass yourself. If you can't do this thing, ask for help. The only difference is that now they will assist you, you watch them and you get better. You can't set that line, ask for help. With time, before you even finish, you become a bado in setting line. You can't pass the NG tube, ask for help. Don't go and do pass yourself. If you can't do something, rather you stay there and be punching patient, pricking patient, ask for help. Ask for help. Let them assist you. Let them be there when you're doing it. Sometimes they may not even want to do it. They'll tell you, "Oh, do it." They'll be there. They'll be guiding you. At least you will get it, but at least you ask for help. Anybody can help you, so don't look down on anybody. Your matrons in the ward, they know that patient more than you. The nurses in the ward, they know that patient more than you. Don't come and be doing, I'm a doctor, I can't talk to anybody. No. Ask for help. Be respectful so that when you need help, they will assist you. Ask for help. So the next tip is always involve your senior colleagues. Like I said, this 1 year of internship, you're under supervision. In as much as you're the first on call, you're the first in line, you're the first person they will come and meet. Anything that is happening, it falls back to you first. still involve them. A patient come, call them, tell them, see, there's a patient in emergency, there's a patient in trauma, there's a patient in this, there's a patient in that. Involve them so you don't go and put yourself into trouble. In short, they should even tell you, they should even be the one giving you, like, making decisions. The only thing you have to do is just to carry out the decisions they decided to make. So they are meant to make decisions. Sometimes they ask for your opinion. Just tell you, okay, so what do you think you can do for this patient? What do you think this patient needs? What do you think? But the final decision does not lie on you. So always involve them. No go do pass yourself. Oh. Involve your senior colleagues. Involve them. Don't take laws into your hands so you don't fall into trouble. Involve your senior colleagues. Let them know everything that is happening, because when wahala set like this, when when wahala set like this, I don't think you want to be in that kind of space. And the fact you are now the youngest of youngest, so involve them in anything you're doing. Let them be the one making the decision. You are just carrying out the decision they have made. Don't take laws into your hands. Don't go and do pass yourself. Don't go and be making decision and be doing things and be carrying out procedures yourself that your senior colleagues are not aware of. Please always involve your senior colleagues. So the next tip is always make acquaintances with everybody around you, your senior colleagues, the nurses in the ward, the matrons, even the cleaners, the security personnel. Just be very friendly, respectful, respect everybody around you, be kind, be nice. I know you're a doctor. Yes, you have a very big title. Yes, but please just be respectful, be friendly, be nice to everybody around you, because you don't know who can help you tomorrow. So not even tomorrow, who can help you in this house job? Anybody can help you. Forget it though, anybody can help you. Always be nice to everybody. In the blood bank, be nice. In anywhere you find yourself, be nice to the lab people. As much as you have to be friendly, but don't force friendship. That's what me I will say. Oh, don't force it. Those that want to be friendly with you, be friendly with them, but don't force it. There are just some people that can be very annoying, even down to senior colleagues. There are people that will just like you for no reason. I experienced that one. The first day I stepped my leg, they did not like me. One particular person, not everybody, but every other person in the unit, I enjoyed. Like, I no, not even one, two people. Every other person in the unit, I was friendly with all of them. Like, we will rap, we will laugh, we will gist. But these particular people they did not just like me. I don't know. Maybe my grace was just too much. I was blinding them. I don't know. But what do? I greet them good morning. I respect them. But will I laugh with you? No. Will I gist with you? No. Will I respect you? Yes. Will I greet you? Yes. You're my senior colleague, so why not? But that's why I say don't force friendship. Don't force friendship. If you're the type that like eye service, you can do it. To me, I don't like eye service, so I did not bother. So don't force friendship. Just try and be friendly to those that want to be friendly to you, and those that want to give you headache, just be respectful to them. And some of the things they will do that will just want to make you angry, ignore. It's not everything you have to say. I think this how one thing I learned in this housemanship is the grace to control my mouth. It's not every time that it's bass. You cannot be giving it as it's doing, as they are giving it to you. You cannot be giving it to them, because you don't want to fall into trouble. But just be respectful. If you see this person does not like you, you cannot force the friendship. Avoid them. Just avoid them. Do not hurt. They try you avoid them, you ignore them. They want to get to you. Some want to provoke you, so they will say you were rude to them. Just avoid them, ignore them, control your mouth. If you wake up in the morning, say, God, Holy Spirit, guide my mouth, guide my speaking, guide my thinking. God, give me the strength to ignore my haters. Give me the strength to ignore people that want to annoy me today. So that's just what you need. You need to ignore. If you want to rant, maybe when you're coming back from work, I remember I remember that unit. God, anytime I'm coming back to work, I'm on the phone and I'm ranting, talking. Everybody, even my father knew. I hated that place so much. But what will I do? I needed them to sign for me so I can move on with my life. So I will call my friends. I'll be ranting on the phone. I'll be ranting, shouting, talking. I hate this, I hate that unit, this one, that one, that one, this one, this one, that one. But that's the only thing. And that thing is don't gonna be crying for anybody. Some people want to see you cry. I kid you not. Some people will want to make you cry. Some people will want to push you to the wall so that you will cry. But more, let even one blink of tears, it should not fall down from your eyes. Even though you want to cry, when you get home, you cry. You can enter inside. Short, when you're in that work environment, don't cry. When you leave that hospital, you can start crying. You get try and be strong, because some people enjoy when they see they've conquered you, you know. So try and be strong. Ignore them. They shout, they talk, they do this one. If you want to say sorry, you can say sorry, but just try as much as you want to ignore them, especially when the person is trying to be petty around you. Ignore. So the next tip is do your job. Please come early to work and do your job. If it's to collect patients, new patients, do your job. If it's to examine patients, do your job. If it's to document patients, do your job. Like, don't be that HO or don't be that house officer that leaves their work undone. Not only you in a unit, you like 2 or 3 house officers in a unit. You just make your other colleagues, like your other house officers, be like, who is this person? She never, they will just know, they'll just have some, not hatred, but some resentment around you. Like, why don't you like doing your job? You like leaving job for them, you know. If you're in a unit, try and people should be a team of house officers. Try and work as a team, because that's how you people can clear work. Oh, try and work as a team, and then don't be, because people are now working as a team, don't come and start doing claiming smart. Do you understand? Don't come and start doing smart. You know, now you now leave work for one person because you know this person is hardworking. No, do your job. Do your job. Let them not know you with that. Always do your job. And at the same time, as you're doing your job, please learn when to tissue. Very, very necessary. Okay, tissue is zap. Know when to zap. Know when to disappear. You know, so you don't collapse, so you don't die before your time. In as much as you do your job, oh, say as I'm teaching people babati. I feel like a bad person, but yes, it is what it is. Oh, in this house job, you have to be smart to survive. To be honest, you have to be very smart. Do your job, but know when to run. When they want to kill you with work, you just look left, look right, and you zap. So still back to doing your job. Please don't be that house officer they are looking for. They are calling, you are not picking. They call you for emergency, you are not picking. They call you from trauma, you are not picking. They want to give you consult, you're not picking to get your consult. Don't be like that. Just do your job. Do your job. I know I had PTSD from calls. Hey God, I hated calls. That time I was in surgery. Once I see call, my BP will just be rising, because I know it's one thing. I cannot even sleep well. Once I see call, I wake up. So just try do your job, but still know when to tissue. Always get consent from your patient or patient relative. So before you do anything on a patient, please make sure you get consent. And not only getting consent, please also explain the procedure, the diagnosis, or anything to your patient before you carry it on them. You want to set line, explain to them. Why are you setting line? Explain to them. Oh, I want to set line so the nurses, or I can give you IV medication. Explain to them. You get a diagnosis, explain what the diagnosis is to them. I know sometimes the senior colleagues can come and do that one for you, but most times explain your diagnosis to them. Explain the procedure you want to carry out on your patient. They are not, what's it called? They are not teddy bears. They are not doll baby. They are not dolls that will just be there for you to be doing anything on their body. Even if it's you will not find it funny if someone is just all over your body and they did not tell you what they are doing. You want to give medication, explain to them. Mama or papa, or say I came to give you your medicine, or say I'm meant to give you your medicine, I'm meant to do this on you. Get consent. Explain procedures, explain diagnosis before you carry it out on a patient. It can be annoying, but ignore. That's my only surviving way in this house job. Oh. I ignore. You can be shouting. I'll not even do as if you even exist. I'll just keep straight face. Everything will just be going like this. So that's anyway, that's that for that. But ignore, ignore if they are annoying. But please try and always explain procedure to your patient before touching them. If a patient say don't touch me, leave, go and document. You can't force treatment on anybody. They say, oh, don't touch me, clear road is even good. That's one I even like. Don't do me that don't even want to work. Oh, if you tell me no, don't, I want this doctor to touch me. So most of the times they want the senior colleagues to touch them. They don't want you as a house officer to touch them. I will gladly leave you. You don't force things on people. So I don't want this one to touch me. Just tissue. Or go and look for where you sleep or sit down and eat or do something. You get. So still explain to them, be polite to them. They are human beings like you know, just condition, that's why they are there. So explain to them, tell them sorry if it's painful, be nice, just be nice to them, explain to them, they are human beings. So explain to them, be very polite to them before you touch them. If it's hurting, you can say sorry. So the next tip is eat and ensure to take care of your health. It's only the living it's only the living that can continue to be a doctor. It's only the living that can treat patients. It's when you're healthy you can treat your patients. Please eat eat food, eat. If you're on medications, make sure you take your medications. Don't do that I'm seeing a patient, I forgot to take my medication. Don't do that you are seeing a patient, you don't want to eat. Please eat food so you can function well. So eat food, eat, ensure to take care of your health. If you have needle prick, if you have injury from procedures, speak up, talk treat yourself if it's to take sample and go to the lab do it if it's to get treatment, to get help, please speak, talk to a senior colleague. Oh, I had a needle prick, needle, something chook me, this one chook me, that one cut me. Talk treat your health first before any patient. Yourself first before any patient. I will say it and I will say it again. Yourself first before any patient. If you die, they'll say, oh, that doctor. They'll not even say you're hardworking. They'll just say that doctor that died, he fainted and that's the end. That's how your own have gone. No. Please take care of your health, eat food. Don't do odeshi nothing is odeshi. Please talk, tell your senior colleague, tell people, tell the consultant, oh, this one chook me, this one, they will now tell you how to go about getting help, getting medication, getting treatment. Please take care of yourself. Please, if anything happens to you, nobody cares. All these people are your colleagues, they are not your friends. No single person cares. They just want you to be working. That's why I say you should also learn how to tissue. Take care of yourself. So this comes to the conclusion of this video. Please, if you have done housemanship and you have any tip that I didn't mention in this video, please don't forget to leave it in the comment section so that everyone who wants to go for housemanship can look at it and also learn. Please, if you found this video very helpful, please don't forget to give me a thumbs up. Please don't forget to subscribe. Don't forget to hit the notification bell to know when next I post my next video. And if you have any question concerning housemanship, please don't forget to leave it in the comment section. I'll be there to answer all your questions. And I wish you all the best in your 1 year of housemanship. And I'll see you in my next one. Bye. Mwah.
Room 2110, I knocked on the door at the penthouse suite, 'cause I needed more from you.